It is a huge honor today to be interviewing what I consider a dental phenomena rock star. I mean, seriously, Dr. Hazel Glasper, and you're out of Marriottsville, Maryland. Is that a suburb of D.C.?
Suburbs like Columbia, Laurel, Maryland, right outside of 45 minutes outside of Baltimore. So the Columbia, Laurel, Maryland area.
So are you a Ravens fan?
No, but my patient was Rex Ryan.
Is that right?
Yes.
Oh, so how are you doing today?
I'm doing wonderful. Absolutely wonderful. Excited about doing this podcast with you.
Well, I've seen you on all kinds of media outlets. I mean, tell our viewers all the shows that you've been on.
Fox 5, NBC, Channel 7, Rock Newman Show, WHUR, Tom Joyner Show, which is syndicated, Roland Martin Show, which is syndicated. I'm speaking all over the place. I'm getting the message out there. I've been in publications as well, local, just doing all I can to reach the public about the importance of oral health and making the connection between your oral health and your overall health. I'm the comprehensive dentist.
Well, and I congratulate you because, I always, one of my critiques of dentistry is that you put a room full of dentists together. They're always talking about drilling, filling, billing, how to do a root canal, what bonding agent, and we need to be spending far more time on how do you prevent disease. Right. And I had a hygienist on the other day talking about a new electric toothbrush connected to an app so children can figure out where they're brushing. Community water fluoridation is still not in 30% of the towns in America.
I applaud you. I applaud you for getting it in Arizona. That's wonderful. Because especially Arizona has a lot of areas where it's impoverished. There's poverty there. So it's important that, they have fluoride in the water.
Yeah, it is very interesting because the people most likely to drink water out of the tap probably aren't going to the dentist or have dental insurance anyway. And then all the crazy anti-fluoridationists who think it's a communist plot and the government's trying to kill you and all that. They're always some yuppie who grew up in a suburb drinking bottled water anyway.
Right.
Have you noticed that?
Yes. Who can't relate to it? What I have found, even those individuals who are out rallying against fluoride tend to have a lot of dental issues, okay? And if maybe they had been on fluoride or, would accept that fluoride is beneficial, it does strengthen the enamel, it strengthens the teeth, then I think they would probably be a lot better. But you know what? You can't change everyone.
Yeah, okay. I've been in two huge fluoridation campaigns. First was my first one in '89. I got out of school in '87, and so from '87 to '89, my every Friday for 2 years was just a fluoridate feeding. So I thought that'd be far more important than building a practice of drilling, filling, and billing. I thought that would be, and when it was done, the guy from the CDC said his epidemiological model thought it would prevent about 850,000 cavities a year. So I just felt like, okay, you're done, dude. You did your magnum opus. You can retire. I felt like
you left your legacy.
And I felt like at 2 years out of dental school, I left the playground better than I found it, and I could go home. But it expired after 20 years. So then we had to go back and do it again. And I'll tell you what, going back through it when you're 50, when you're 20, when I was 20, I got out of school 24, 26. You thought if you just showed everybody the science, the research, and gentlemen could all agree. But going back and doing it again at 53, I just realized that about 20% of all Americans are completely batshit crazy, and you're just never going to change their mind. I mean, they were telling me that this stuff was so toxic there was no place to put the fluoride, so they bribed the government officials to pour it in the drinking water because there's no other place they can get rid of it. I'm like, dude, are you not aware that the United States has areas where they detonate thermonuclear bombs? Don't you think they could pour the fluoride there where they're and it's just like it's just crazy. But
it is ridiculous, and it is hurting. It will absolutely hurt their children. It has hurt them. And it is hurting a great population of individuals who truly need to be exposed to fluoride. But you can't change everyone's mind. You have to change the minds of people you can. Okay? That's all you can do.
But
With the Teach Me Dental campaign, I'm out there trying to change the perception of oral health. I'm trying to actually brand dentistry and do it with using pop culture. So we're doing different type of imaging and different type of advertisement. We're talking about all things dental. So anything that anyone wants to talk about. I was on the Roland Martin show recently, and we talked about the dangers of kissing, how you can spread bacteria from a spouse, from significant other, between partners, and to your children. And people are saying they've never heard this. So it is, we talk about oral cancer, we talk about gum disease, we talk about dental decay. So Teach Me Dental has reached over 1 million people so far. It's a great campaign. Absolutely great campaign.
And are you the founder of Teach Me Dental?
Absolutely.
And that's you, a one-woman rock band?
Absolutely, I'm not.
But I mean, is there other people on your team, Teach Me Dental?
Yes. Well, I have 2 companies actually. Teach Me Dental is the nonprofit that we're forming, and we've reached over 1 million. And the other one is the Comprehensive Dental Continuum. And that's where I am going to go into the dental community with speaking and coaching dentists on how to practice comprehensive dentistry. Introduce it. I think there needs to be more comprehensive dentists.
And what do you mean by what is your definition of a comprehensive dentist?
As a comprehensive dentist, I look at the whole picture. So my focus is not just on teeth. As a matter of fact, I think that we should stop selling teeth and start promoting health. That's where I come from. Every single patient that I treat from the perspective of health, function, and aesthetics. So I completely understand what systemic conditions that my patients are suffering from and what oral effects they're having. I'm in cross-clinical conversations with other doctors in other branches of medicine. I know the conditions of the oral cavity that have systemic effects. So I think that being a comprehensive dentist, looking at everything, doing a complete examination, complete diagnosis, presenting a complete treatment plan, and addressing all the patient's needs is how we're going to help prevent diseases of the oral cavity, as well improve some of the diseases our patients are struggling with.
You know, I think that the kissing thing, it even blows my mind among dentists. I mean, you'll see a dentist who has seen the wife every 3 months for 10 years for 3-month cleanings, and she still has bleeding gums and she's on perio maintenance or whatever, and he's never seen her husband.
Her husband.
And he's got a lingual calculus bridge, blown molars, and it's like it's so weird around the planet, because below the belt, after HIV, after AIDS, the whole planet knows that below the belt you can trade bacteria, viruses, germs, fungi, and kill each other. But above the navel, the whole world hasn't even thought about it one time, including dentists.
Including dentists. They have no idea that in a healthy mouth, you can have between 1,000, 100,000 bacteria on a tooth. In an unhealthy mouth, you can have between 1 million and 1 billion. So an unhealthy mouth can have as many bacteria in the mouth as there are people on this planet. So we wonder, how is this leading to heart disease, strokes, lung infections, cognitive issues, adverse pregnancy outcomes, increased cancers, prostate problems, impotence. We have to realize that the mouth is the gateway to the body. And you're right, a lot of dentists practicing in this isolated way, doing more drill and fill dentistry versus truly treating their patients in a comprehensive way is, one, affecting how we're being perceived in the medical profession. We're being perceived as just dentists, not really doctors. And so a lot, when we try to communicate with the endocrinologist or the orthopedic surgeon or, the OBGYN, they're looking at us like, well, this is just about teeth, right? But it is not just about teeth. It's about overall health. And so we have to get on board as a community and take a stand in medicine.
But it is interesting how the human mind compartmentalizes the body, and they have a hard time realizing the mouth is connected to, the arm or the foot or the liver or the kidney, or, it's just.
Yeah, but we can't have a hard time. As dentists, we have to understand. So the entire population outside of us might not get it, but it is our responsibility to educate them, because that's how it's going to be different. It's going to make a difference.
Yeah,
like with fluoride.
Yeah, and dentists can increase their hygiene recall, because it's no doubt there's more women. Over 65% of the people that come in for their routine cleanings are female versus male. I mean, it's always been a 2-to-1 ratio, because women are just more into beauty and aesthetics and looking good. When I want to look good, I just turn out the lights and to enhance my appearance. That's the only thing I do. And but when you just tell the wife, you go home and tell your husband you're never kissing him again until he gets in here, because you can't fight brushing and flossing and coming in here every 3 months while your husband Piglet hasn't been in 10 years, and one kiss could give you 1 billion and more virulent bacteria.
Right. My tagline: what is your dental status? What is your dental status? So why come every 3 months? Why come every 6 months if your husband is reinfecting you? And what about what you're sharing with your children? How often are you sharing a glass or utensils with them? But unless we educate them and come out with a bang and really let them see that this is not just about a collection of teeth, and get them to understand. I remember my first patient who passed away in my practice. He came to the practice about 17 years ago, and he had just had a battery of tests run. So he was in good health according to most of the medical profession. But I diagnosed him with advanced gum disease. And he said, all I want is a basic cleaning. A basic cleaning, that's it. So because I just started my practice, I didn't want to lose a family of 4. I allowed him to stay in the practice. We continued to educate him. We made the links. Even then, I was making the links between your oral health and your overall health. Finally, because HIPAA wasn't in place, after a year, I went to his wife to convince him to have the periodontal surgery, because that's where he was at that point. He had a massive heart attack before we could ever get the surgery done. And so a lot of us in the dental profession, I assume that we know, once they do autopsies on a lot of these patients and they evaluate the clot, it's 70% bacteria, and about 40% of that comes from the mouth. What we do is very serious. And so as a profession, we need to own that. We need to accept that we are on the front lines of a dental health care crisis.
So what are you doing with Teach Me Dental? How does that actually work? How could people that are listening to your podcast today, there's thousands of dentists all around the United States, what are you exactly doing, and how can they help?
So initially what we decided to do was just start educating the public on TV, radio, publications, social media. And so we're on Twitter, we're on Facebook. We need more dentists joining the conversation. I have a lot of dentists following me.
On what? On Twitter?
On Twitter.
What's your at Twitter? What's your?
It's at Teach Me Dental.
At Teach Me Dental. Okay.
At Teach Me Dental. And what we're doing is we're just getting the facts out to the public about what's really happening, what's going on in dentistry, and how you should view dentistry, how you should look at dentistry, and trying to take the focus off of just teeth and on the entire system. So when I talk about being a comprehensive dentist and I explain the fact that every single patient is dealt with from the perspective of health, function, and aesthetics, as dentists, we have a responsibility to not only restore the health of our patients, but to understand the function of this system. When you think about how important this system is to breathe, to speak, to eat, to smile, to taste. I mean, most people could not survive without some of those functions. So we have to let the public know that dentistry is a branch of medicine. We are doctors. And it is important that you take care of your oral health because it matters.
Now, when I tried to get on a TV show like you, they told me I had a face for radio. So do you have to be good looking and fancy looking like you to do this? Or how did you actually get on TV?
Well, I've asked to come on and talk about dentistry. I work with individuals who believe in my cause. I'm the spokeswoman for the American Heart Association on oral health in Maryland. So I believe in this. I was on CNN speaking as a spokeswoman for the American Heart Association. So people want to know about oral health. They want to know that it's not just about me going to the dentist asking him to fill my tooth or clean my teeth. And so the Teach Me Dental movement is more consumer-based. The Comprehensive Continuum is more dental-based, where I want to go into the dental community and educate on how we can make a difference in medicine, how we can affect so much and improve and extend the lives of individuals.
So did you, you're out there in Maryland where the first dental school was, Baltimore, Maryland. And I guess the story goes, you can correct me if I'm wrong, true or false, that basically dentistry and medicine got separated because the dentist wanted a stand-up chair and the physicians wanted a lay-down bed, and that it was that architectural design that kind of separated the two. And a lot of people think the Soviet Union system, where the undergrad and the first several years of med school are all the same, and then you can go off into dermatology or gynecology or stomatology, which is dentistry, is a better system because they're all in the same system. Do you think dentistry would be closer to the oral health continuum if dentistry was a branch of medicine and not its own standing branch?
Well, dentistry is a branch of medicine. But the fact that it's separate from conventional medicine or allopathic medicine, yes, it makes it look less important. And because, way back then, they didn't choose to put us into the curriculum. But we know that the first 2 years of dental school is like going to medical school.
At University of Missouri, it was the same teachers.
Exactly. So, but a lot of the people that we serve don't know that. The people we serve think that, we start dental school and we start drilling on teeth instead of understanding the anatomy. They don't realize that, we worked on a cadaver just like the individuals in medical school. So there is this perception of dentistry that most people, it's wrong.
I want to talk about the most fundamental part of our whole profession. If every time a human was born, it was thrown over a wall and they had no contact with the rest of us, there would be no streptococcus. Humans aren't born with streptococcus mutans for decay, P. gingivalis for gum disease, HPV for oral cancer. I mean, there's just 1,000 diseases that they would never have if we just, said, okay, from this day forward, all newborn babies will be thrown on Antarctica. And they'll, I have my first granddaughter. She used to have 4 boys, and the oldest one made me a granddaughter. And I knew she wasn't born with Streptococcus mutans. I knew she'd never get a cavity till someone kissed her. I knew she could never get gum disease till someone kissed her. I knew she couldn't get HPV until someone kissed her. And it's just amazing. I mean, she's my granddaughter. How many people just always kiss her and on the mouth and aren't even family and and cousins and nephews, and the nieces come over and the first thing you start doing is smooching around. How are we ever going to stop a society from kissing babies on the mouth?
Educate them. Here's what my parents did, and what my mom did. My mom had advanced gum disease. Of course, we didn't know it. I didn't know it until I graduated from residency, my residency program. But I don't know that if your wife did this or you did this with your kids, but my mother would chew up food and put it in our mouth. So she passed it on to us. And so, and she wasn't trying to in any way pass on any harmful bacteria because she didn't know. And she probably still don't get it.
Right.
Because that's just something that you did. So, right, we are introducing this bacteria to our children. Kids are doing it with the band instruments, and they're doing it just sharing a lip balm and all this other stuff. But the worst part about it is that they still don't know that if you're not truly addressing the issues of gum disease, which is found in 80% of the adult population and is increasingly found in children, that if you're not addressing it, that it could cause death in the future or could cause a very compromised life. My brother Tony lived in Texas. He died from an infection, a sepsis infection that is believed to have come from his mouth.
Your brother?
My brother.
I'm so sorry. And his name was Tony Glasper?
Yes.
And how long ago was that?
April 27th, 2014.
Oh my God. You're still in a lot of pain then.
Enormous pain. See, and even I was committed to this cause even before that happened. But can you imagine how committed I am to this cause now? Because I have so many stories in my family, and I know it just can't be my family. It has to be other families. It can't just be my patients who are sick and dying. There are other patients in other practices that are sick from these chronic oral conditions. And as a community, as the dental community, we have to take responsibility and completely acknowledge that we are not always diagnosing and treating the conditions our patients are coming in with.
And that's why I reached out to you. You didn't reach out to me. The reason I reached out to you is because dentistry, I got a bad taste of it when I first got out, because you'd go to these institutes and they talk about this high-end, expensive dentistry and how you wanted to build a practice of the right patients, and these are A patients and these are B patients, and you don't want the C patients, and here's the D patients. And when they would describe the C, D, and F patients, that was the entire Farran family pedigree from Kansas. I mean, we're born in a barn. When you do my family tree, you'll find goats, pigs, cattle, and
country folk.
Yeah, and the public health dentists don't get the attention that the cosmetic dentists get, that the implant dentists get. Even with implants, everybody that lectures on implants wants to show how to do full mouth implants for $50,000. They never want to go show a course on mini implants, how you can take an existing denture and make it 10 times better with just two little mini implants. Because no one wants to talk about the poor. And I think that as a dentist, we're all public health dentists.
Yeah.
And I don't care if you're in Beverly Hills or Kansas, we're all public health dentists. And your efforts of water fluoridation, get into schools and education, I think you're amazing how much media you've got access to. But I have a pretty good hunch that it's not just your passion, it's your beauty. If you got passion and beauty,
Yeah.
I'm sure they're all calling you. No one's ever
Well,
called me.
I'm almost 6 feet. I look like Grace Jones if you see me up close, but yeah, I think that helps. But
So you're a 6 foot runway model, huh?
almost. But I've studied with a lot of the guys that you're talking about. I've studied with the Dawsons, the Hornbrooks, the Dorfmans, the Spears. I've studied with them, the Nash. I've studied with all of them. I believe that they're doing some incredible dentistry, and I think that we all should have a commitment to the patients who cannot afford that level of care.
I'll hold your feet to the water. Tell me this. So the Obamacare debate was monstrous. Where was the dental community that just went to Obama and said, dentistry is 5% of the dental budget? For Obamacare, can we just have one little dental deal that we're not going to put community water fluoridation up for vote in 19,022 different cities? So on any given day, 30% don't have it. If you could just give it, we don't put up vaccinations for smallpox and measles and mumps and rubella to 19,022 city councils every year. So for them to sit around and vote on whether your kid should be immunized to go to school, why this is the only public health we don't put up to city council about whether milk should be fortified with vitamin D or salt should be iodized to get rid of. Why is our profession the only one that's not a national policy? And I almost cried when my profession during that whole Obamacare just can say, hey, the dentist, we're over here, we're 5%. We just want one thing: water fluoridation, a national policy. I mean, it was crickets. You didn't hear one word from the dentist.
Right. But we have to respect what we bring to the table. We cannot expect anyone else to respect what we do if we do not understand our role in medicine, right or wrong. If we do not understand that we help save lives, that we transform people's lives, that we make a difference in medicine, that we could help the cardiologists, we could help them get their patients healthier. They need to know that, and they need to work with us. When that happens, then Obamacare will start looking, Obama and his, insurance the system will be different. Dentistry will be considered important. At this point, Howard, is it important? Is it important to most people that other than the fact that if you're in pain, you can go to the dentist? But are they looking at it in this, that it could save your life? Are they looking at it? No. Are dentists looking at it in that way?
No. Did you think they are?
No.
Yeah.
No.
And in my backyard, the bodies are starting to stack up. In my backyard, and that is after the AIDS deal, everyone believes that you transmit diseases below the belt. But now this whole world believes that if you put on a condom downstairs, you're all good to go. And then they, I'm telling all my boys and each one of them has 2 or 3 friends that, if you have to put a condom on downstairs, why would you stick your tongue in her mouth upstairs? And now they're trading HPV, and people are dying.
People are dying. And it used to be an African-American male cancer. And it isn't that anymore.
Did it really? What HPV cancer was an African?
White men and white women. It's affecting everyone. And it is because of the HPV virus. The HPV virus is exploding and causing oropharyngeal cancer among men in record numbers.
But none of those college boys know at ASU that they still believe that, well, if you have a condom on, you're good. They don't even cross their mind that, well, you're going to make out with this girl and you're going to trade saliva and that there's
and do all other kind of things.
Yeah. So and that, why is that not on the TV? Why is that not on CNN and Fox News? And
but it is. I'm talking about it.
And we had two famous people come forward. We had the movie star in California that had the oral cancer. What was his name?
Michael Douglas.
Michael Douglas.
Michael Douglas. Roger Ebert. Roger Ebert died from, he had two different types of cancer, but oral cancer was what, finally took him.
Now, who's Roger Ebert? Was that the
critic?
The critics. Roger. He was the heavy. He was the skinny one, right?
The heavy set one.
Okay, so he was the big heavy set one.
Yes.
And he died of oral cancer.
Yes.
I did not know that. Well,
I think he had thyroid cancer. He ended up losing his jaw. I would love to do, Howard, is have an event around oral cancer through the Teach Me Dental campaign and have his wife, Chaz, come and speak and bring attention to oral cancer in a way that it hasn't been.
And what was his oral cancer from? Was it from HPV or smoking or what? You know what it's from?
No.
They don't know. And then the Buffalo Bills guy, the famous guy.
Tony Gwynn.
No.
The baseball guy as well.
Who's the baseball guy?
Tony Gwynn.
Tony Gwynn. What baseball team was that?
San Pedro's something.
But who was the Buffalo Bills? Was it Jim Kelly or some Buffalo Bills?
I'm not certain about.
Yeah, but it's I think he might have that. I'm not sure. You just hear rumors, but I can't believe that one person dies every hour of oral cancer. 50,000 a year, right?
And do you know how prevalent it is? It's more prevalent than skin, cervical, thyroid. I believe last I checked, cancer of the testes, Hodgkin's lymphoma, certain blood cancers. And by the time that it's diagnosed, it's in the late stages. And according to what's been stated, only 25% of dentists are truly checking for oral cancer. It was some debate that I read, who should be checking for oral cancer? Now, if dentists are not checking for it, who should be checking?
I know. That is just crazy. So what's your next move with the comprehensive dental curriculum? What are you going to do there? Is that something you're going to do in Maryland, or is that something you're going to do on the road, or are you going to have a place where people come to you to learn this, or what's your thinking?
So I was at the American College of Dentists the other day with some leaders from the National Dental Association trying to meet different individuals such as Patricia Blanton, trying to meet, because I'm trying to get on the speaking circuit. So that's one thing that I'm doing through the Comprehensive Dental Continuum.
You know the fast track to the speaking circuit?
Uh-huh.
You know what the fast track to get on that is? There's about 275 dental societies in the United States that bring on speakers, and they're all nonprofit. And so an executive director always gets a committee of 3 volunteer dentists who raise their hand, and they're in charge of picking the next speakers. And she'll say, okay, get one on endo, get one on perio. And then the number one complaint of every meeting is there's nothing for the staff, which you would fit under, the whole staff. Mm-hmm. And then they go to Dental Town, where we have 350 one-hour courses divided up by endo, perio, pedo, pros, practice management. And so if I'm in charge of the endo speaker, I might go watch 6 one-hour courses by 6 different endodontists, and then say, I really like the third one. Mm-hmm. And I know people who put up a single 1-hour class on Dental Town that started speaking 60 times a year. Mm-hmm. So I would put a course up on Dental Town, mm-hmm. and look at that as kind of like being on, what are those dance?
The Winfrey Show.
Yeah, or some Celebrity with the Stars show. Some sure. content, and they see your audition. That's what I'm trying to get at. It's sure. like an audition, and then a lot of the dentists watch that will sit there and say, "Wow, I want Hazel to come speak at our meeting." So that's a huge thing. And then I would love to do something with you on the Dental Town magazine.
Yes, well, I have an article that I want to publish through your magazine. I would love to send it to you for you to read on comprehensive dentistry, my philosophy.
I just want to put your picture on the cover to double the readership. That'll make people pick it up and open it before they throw it in the round file. Yeah, anytime you want to do that, you just send it. I'll
Yeah.
put your picture on the cover, and whenever it's a short fat bald dentist, most articles are submitted by short fat bald dentists, so you just throw all those away. But yeah,
Well,
I would love to have an article on it. What would it be on? Would it be on the Teach Me Dental, or would it be on the Comprehensive Dental Curriculum, or a little both?
comprehensive dental curriculum. And see, my goal is to get into the dental community and start really teaching dentists how to practice more comprehensively. Sell more dentistry, save more lives. And that might sound like, ooh, what does that mean? But it simply means doing a complete examination, a complete diagnosis, a complete treatment plan, executing it at a level for which you are trained and skilled, and really improving the health of individuals out there. Make a difference. We can make a difference.
So I've always thought that the difference between you and the majority of dentists is they just sit back and the patient is the dog and the dentist is wagging the tail, and they come in and they point and they say, this tooth broke, can you fix it? And 80% of the dentists open the mouth, take an x-ray. Yeah, that tooth needs a crown. I can fix that. And then there's that's 80%. Then these other about 15% sit there and go to quadrant dentistry, where they say, well, if I'm going to numb this whole quadrant, this whole jaw area, it not just needs a crown, but the tooth behind it needs a filling, the tooth in front of it needs a filling. Why don't we fix up the whole quadrant? And then there's only this top 5% max, and it's probably more like 3%, that just say, slow down, slow down, slow down. Okay, you came in for this tooth, but we're going to take a full set of x-rays. We're going to measure your gums.
Exactly. The process is, you do not touch a patient until you have a complete series of images, a complete x-ray series, a comprehensive periodontal evaluation. You totally educate your patients. You cannot do a treatment plan without fully understanding the health of your patient, talking to their doctors. I mean, I'm in the middle, because I do full mouth rehabilitations. I do major dentistry. I do exquisite dentistry. I do lovely work and very proud of the type of work that I do. And my patients are extremely happy because they feel empowered, they're educated, they feel more confident, they're healthier. But it's a way to go through that, and limited care is not the way. You don't let a patient dictate. If you're the doctor in that room, then you're the doctor in that room. The patient is looking to you to educate them, inform them, show them with all, dentists are gadget people. We have so many gadgets, but we need to use it to educate our patients. And so I'm old school. I'm old school in that I do it like I was taught in dental school.
Speaking of your school, rumor has it that you went to Howard University simply because it was named Howard. Is that true? I heard that on the Howard Speaks podcast. That was your only criteria to dental school, is that it starts with Howard. So take off your dentist hat and put on your Dr. Phil hat and crawl into the head. Most of these podcast listeners are kids. It's a hot technology on their iPhone and dental schools. How can you get in their head? Because this is what they're going to say. I know what they're already saying. They say, Hazel, you don't get it. Because when they call up and they say, I just want an appointment to get my teeth cleaned. I just want my teeth cleaned. I don't want the new patient exam. I don't want that deep cleaning. I just want to come in there and get my teeth cleaned. So they say, okay.
I deal with that. I deal with that every day.
So give them some speaking skills. I mean, you've heard this for 25 years. Give them, and maybe their practice is 1 year old. Give them some dialogue of when she says, Dr. Glasper, I just want my teeth cleaned. I don't want all the x-rays. I don't want a deep cleaning. I just want to come in and get my teeth cleaned.
I can't do it. That's not how I practice. I cannot properly diagnose you without having the proper x-rays. Would you go to the orthopedic surgeon, you have a problem with your ankle, he needs an x-ray, that's the only way that he can fix it, and tell him, but I'm not doing that? How often do you think that happens? I cannot properly diagnose and treat you without having these diagnostic aids. It really is that simple.
So you're just putting your foot down and saying, no, I'm not going to cater. I'm not going to be a subpar dentist because you want me to.
I never have been, not one day. The thing about me, I know the business of dentistry, I know it in and out. I know insurances in and out. I have chosen in my career to practice at a certain level, and I absolutely never compromise. I do not compromise. I have the same patients as everybody else. But my patients have to accept that in that room, I am the doctor. And unless you have some training that I'm missing here, then this is my recommendation. Now, there are various options, but the option is never to treat you and you have periodontal disease and I'm doing veneers on you, or treat you and you have oral infection, or you have a suspicious lesion and you're in my practice. If it's still there after 2 weeks and we continue to monitor and it is not changing and I don't know what it is, guess what? We need to get another doctor involved. So I truly follow the guidelines of comprehensive care on every single patient I meet. Now, of course, there are emergency patients, but there is an art. I worked at this practice with this Jewish guy in Silver Spring on New Hampshire Avenue, and I learned the art of doing certain things. He learned a lot from me, just my personality and his personality. We were a dynamic team, but he understood the business of dentistry. He understood insurances, and he taught me from a babe how to go out there, talk to patients, and really educate them. And I taught him how to do quite a few things in dentistry as well. So I have always practiced like this from the moment that I came out of dental school. You know what I would love to do, Howard? I would love to go into the dental schools and start a workshop. And I actually talked to Dr. Rouse before he left Howard University. Have me come in and teach the kids how to truly treatment plan, the art of case presentation, the art of treatment planning, how to really go over these medical histories, how to practice comprehensively.
But with 2 million dentists around the world, that's why I wish you would digitize it and go online, because when you put that course up on Dental Town, I mean, they'll be watching it from Latin America from Kansas to Kathmandu. While you're sleeping, they'll be watching it in Asia, India, Africa, Latin America. And there's only so many hours of the day, and that's why I really try to get a lot of you guys to digitize it.
Okay.
We put up 350 classes on Dental Town, and I got the idea because I'm in Phoenix and I saw the University of Phoenix online in 2004, and that's where I stole the idea. And since then, we put up 350 courses. They've been viewed over 500,000 times.
Wow.
I mean, think how many times you have to go to a dental school to get that type of reach. So. And when I go into so many of these dental schools in Asia, Africa, Latin America, pretty much all the curriculum that's within 10 years old is on online courses.
Yes.
Their textbooks are often 25 years old, and it's not uncommon to find the textbooks in languages that none of the students can read. Isn't that amazing? Like there'll be French books or Mandarin Chinese books, and everyone in the school speaks Nepalese. And you're just like, okay, interesting. Yeah. So I want to go back. I hate to ask you this question because I hope you don't think it's unfair, but you are a woman and I am a man, and in your lifetime, it's gone from pretty much an all male profession to half the dental school graduates are female. Some of the young females in the school are asking me questions that I don't feel qualified to answer, and they say, well, it's going to be different for me because I'm a girl. So you've been a woman, female dentist since 1991.
Yes.
So was it harder for you being a woman? Are there issues of being a woman dentist that are tougher than if you would have been a man?
I guess my mindset, I'm a different type of gal.
Because you're 6 foot tall? Is it? Is it
Maybe
because you could? Is it because you could beat up most of the bed, or what? What?
no. I'm not easily intimidated. I don't. I agree that I'm a woman. I'm an African American woman. So for some individuals, I don't know how they look at that, but I look at it as a strength. I look at what I do as a strength because women can be very nurturing. Our communication skills tend to be pretty effective, and we tend to show a great deal of compassion and empathy. So
Everything a man is not. Men don't talk. Basically, if you throw them a sandwich, they'll shut up. They don't talk. They don't convey empathy. They don't convey sympathy. I think a woman dentist would have a massive advantage in pedo. Anybody has anxiety, pain. I mean, all my doctors are women.
right, and most of the women are making a lot of the healthcare decisions in their families. So a woman speaking to other women, the patients who are in our practice, and we know, like you said, most of them are women because women tend to take care of their health more than men. So being a woman is definitely it doesn't.
Okay, I want to answer. I want you to answer this question for me. I'm a woman. I got out of school. I worked for Dr. Mann for 3 years, and this is how he managed the staff. And then he retired. I bought the practice. I say the exact same thing, and they don't jump like when he'd say it, they'd all jump and scatter and run. When I just say it, they just argue with me. Why they say that they don't react to them as they did the selling doctor that's a man. Do you think that's because that buying doctor is actually a female, or do you think she's just carrying herself differently?
I think we have a issue with self-image, and not only just women dentists, but I'm not saying all dentists, but if we don't believe in what we're promoting, if we don't believe that it's necessary, then people are not going to accept your treatment. I think it's the individual. I think if I believe it, then my patients feel what I believe. But if I'm hemming and hawing and I'm not quite sure, and yeah, we can do that, but I don't really think you should do that. And yeah, but if it doesn't hurt, and you want to think about it, why don't you call your husband? You want to get him in, then they think, well, so it must not be that important. Dentistry already we're a stepchild. It's an afterthought. It's been minimized to just teeth. So if we're carrying that into our presentations, our case presentations, then the patients feel it. I do not think women are in any way lesser than, and even if a patient is viewing me in this way, patient walks into my practice, they probably are looking for a white man in this practice. Okay, just because of where it's located. And they look at me. Half of my hair is shaved. I was blonde at the top. And I don't expect them to turn around and leave. I don't expect them not to listen to me. I expect them to follow through with my treatment. If you feel like you can find better treatment elsewhere, guess what? Go. That's my thought.
And it's all confidence. I mean, I was listening to a dentist present a treatment plan, and this week, and I mean, I didn't even know what to do. I mean, he basically said there's like 4 different things you could do, and you could just tell the patient sitting there like, "I'm sorry, aren't you the doctor? I mean, shouldn't you be like leaning towards one? What am I supposed to do? Flip a coin? I
Right.
mean, and then people like you. And the other thing that you said that I'm afraid might have flown over a lot of the kids' heads is, most of the questions on associates are, well, this guy's going to pay 30%, but I have to pay half the lab bill, and this guy's paying 35%, but he'll pay like, which job should I get? And I'm like, really? It's just an analytical. You chose a mentor. You didn't talk about what he paid you, or if he paid half the lab bill, or if he had a 401k or paid for CE. You liked your dentist because he was mentoring you. He was taking a baby and mentoring you.
Well, let me say this. Even in the worst associate situations, I tried to see what I could learn from that situation. So I brought value to him. And he was in business for many years. He was a successful gentleman. He had no real interpersonal skills. Okay.
He was a man.
He was horrible with the staff.
Oh, he's a man.
But he had elements that I wanted to learn from. And once I learned from him, I left.
True or false? Whenever you hear all the women in the staff say they absolutely love working for their male dentist, that guy's gay. I swear, the gay dentists I know in Phoenix, oh my God, they bring cupcakes to their staff. They're always they remember every birthday and holiday. Oh my God. I tell dentists, I said, the gayer you can be, the more money you're going to make. Just try to be more gay. That's my advice. So what would you, so there's a 25-year-old girl listening to you right now. She's a senior in dental school, and I don't want to give away your age, but when she grows up, she wants to be like you. What are the stair steps? Because here's things she's thinking. Should I go do 2 years in the public health service or the Navy or corporate dentistry like Heartland? Should I pay out my student loans before I buy a practice? If I do buy a practice, should I also buy, I got $350,000 student loans. The practice is another $400 to $500. Then when I buy the practice, the CEREC machine's $150, a 3D laser's another $100, a BioLace is $75. Whoa. And then I say, slow down, Spanky. I'm 53, you're 23. We all didn't get there overnight, but give her a stair step deal of where she can, which step would you take in which order to get from here to the second floor where you're standing on?
Seek comprehensive dentistry. Comprehensive dentistry is going to be the thing that is going to make you continue to have passion for what you do. It's going to bring profitability to whatever situation you're in, whether you're an associate or whether you're trying to own a practice. There is a process when you practice comprehensive care that is almost like slam dunk. And if you do that, instead of, please do not get in the habit, the new graduates, the recent graduates, the one who just opened up their own practice, do not get in the habit of doing drill and fill dentistry, limited care. Get in the habit of spending time with your patients, build relationships with them. Learn all of their dental needs, educate them, make a difference in dentistry. Instead of patching up teeth, make a difference in dentistry. When you do that, it will change your life. And call me.
Can they call you?
Yes, absolutely.
How could they contact you? What contact information are you going to give them?
They can connect with me on LinkedIn. They can drglasper@gmail.com. I'm pretty busy nowadays, but I am trying my best to return all emails and phone calls. I'm trying to get on the Dr. Oz show and some other places. So trying to make the greatest impact that I can, and as well trying to mentor young dentists coming out or existing dentists on how to change some things they're not happy with their practice. And so
So
I'm trying to do a lot.
So what are all your websites? What is revivesmile.com? REVIVE smile.com. What's revivesmile.com?
That is my office.
That's your dental office website.
Right.
And then what is your website for Comprehensive Dental Curriculum or Teach Me Dental?
Right.
Are they all at revivesmile.com?
The Comprehensive Dental Continuum website will be launched in about 3 weeks. So they could just write the name down. In about 3 weeks, they'll be able to connect with that one and the Teach Me Dental as well. See, I'm doing right now, Howard, everything that I'm doing it with my own little team. I need now to get out there and connect with the Colgates, the Invisalign, the individuals who are doing great things by putting toothpaste and mouthwash on TV. But I need to get with them to help me get this message out here and truly make a difference. So the Pattersons, the Henry Shines, and all those individuals who want to really change how dentistry is being viewed and promote dentists as being part of the medical field.
And I applaud you for that. I think you're one of the most special people in all of dentistry. I adore you. I love you. I do. I think you're probably, I can't think of a bigger rock star in dentistry. And you couldn't be a rock star unless you weren't a supermodel also. I mean, dentistry's not going to put up a short, fat, bald guy and give him a message to put him to sleep. You're the perfect face, image.
I'm not doing this. I'm doing this. I think dentistry should get behind me, but I'm doing this. That's what I'm trying to tell you. Hazel Denise Glasper, along with people who believe in my cause, they're working with me, not dentistry.
Well, I'm working with you, and I'll be glad to put you on Dental Town. I'm doing a podcast with you. Thousands of dentists are going to hear that. I'd love it if you ever do put a course on Dental Town. So anything I can do to help your reach. But so now that you talked to me, you went to dental school just because named Howard. After talking to the original Howard, are you going to shave the top of your head like me just to match?
Yeah, I can shave the middle and leave a little hair right here.
Well, hey, I just think you're adorable. I love your passion. I love your mission. I love everything about you. I just want to tell you, I can't wait to meet you in person. Just always consider Dental Town here to serve you. Whatever you need from me, I'm here to serve you. And a big shout out to Gold Dust Dental Laboratories, Jen Robinson, who's your big fan too. Did you know that?
Yes.
And her adorable husband, Pete Janicki, who I think is one of the smartest guys in all of dentistry. But hey, thank you seriously for all that you do for dentistry. Thank you for all that you do for patients. Thank you for being a role model for all dentists. And thank you for spending an hour with me today.
Thank you. And I'm going to send over that article.
Okay. I'm Howard at dentaltown.com.
Thank you. Thanks for everything.
And we're not putting your picture on the front of Dental Town until you shave your head just like me.
Okay.
All right. Bye-bye.
Take care. Bye-bye.